I'd like to associate myself with the words of the senator from California and commend her for the tremendous work she did on the transportation bill, a bipartisan bill that passed overwhelmingly here in the Senate. Madam President, I'd like to join many of my colleagues who this week are talking each a little bit about the Affordable Care Act, which tomorrow will celebrate its second anniversary of being signed into law by the President. Even though the law won't be fully implemented until 2014, millions of Americans and Minnesotans are already enjoying benefits from important provisions in the law. For example, no child in Minnesota, no child in New Hampshire, no child in America can now be denied health insurance coverage because he or she has a pre-existing condition. Parents across Minnesota and around the country can sleep a little bit easier knowing that if their child gets sick, they'll still be able to get the health coverage they need. That's a big deal. Speaking of parents, young adults can now stay on their parents' health insurance until they're 26. Thanks to the Affordable Care Act, 32,189 young adults in Minnesota are now insured on their parents' policy. Because of this law, health insurance companies can no longer impose lifetime limits on health benefits. Just a few weeks ago, I heard from a Minnesotan in his 30s with hemophilia. He had already hit his lifetime cap 3 times. But because of the health reform law, he still has insurance. And no American can ever again have their health insurance taken away from them because they've reached some arbitrary lifetime limit, and I am proud of that. Now let's talk about seniors. I go to a lot of senior senators around my state. I know the presiding officer goes to senior citizens around, senators around New Hampshire. Because of the health care law, more than 57,000 seniors in Minnesota received a 50% discount on their covered brand name prescription drugs when they hit the donut hole, at an average savings of $590 per senior. By 2020, the law will close the donut hole entirely. You know who likes that? Seniors. You know what else seniors like? The fact that in 2011, 424,000 Minnesotans with Medicare received preventive services without copays, such as colonoscopies and mammograms and free annual wellness visits with their doctors. I could go on and on with what we've already gained, but I want to talk a little bit about a provision that I wrote with the catchy name medical loss ratio, which is sometimes called the 80-20 rule because of my medical loss ratio provision, which I based on a Minnesota law. Health insurance companies must spend 80 to 85% of their premiums on actual health care. This is 85% for large group policies, 80% for small group and individual policies. They must spend 85 in large groups, 80% in small group and individual policies on actual health care, not on administrative costs, not on marketing, advertisements, not on CEO salaries, not on profits, but on actual health care. And we've already heard that the medical loss ratio provision is working. Plans are already lowering premiums in order so that the companies can comply with the law. For example, Aetna in Connecticut lowered their premiums on an average of 10% because of this provision in the law. Another key provision in the law is the value index. The value index rewards doctors for the quality of the care that they deliver, not the quantity. For the value of the care, not the volume. My home state, Minnesota, is a leader, if not the leader, in delivering high-value care at a relatively low cost. And traditionally, we in Minnesota, our health providers have been under reimbursed for it. For example, Texas gets reimbursed 50% more per Medicare patient than Minnesota does. Now, this isn't about pitting Minnesota against Texas or Florida. It's about rewarding those states, those lower value states, to become more like Minnesota. Imagine if we brought down Medicare expenditures by 30% around the country, while increasing its effectiveness. It will bring enormous benefits, not just to Minnesota, but across the country, because it will bring down the cost of health care delivery nationwide. And that's what we need to be addressing, the cost of health care delivery. Because we all know that bringing down health care costs is key to getting our long-term deficits in order. In fact, there's probably nothing more important than we can do. And that's where the value index is so important. I've gone over a number of the benefits from health care reform that have already kicked in, but I obviously didn't mention them all. For example, health care reform has already added jobs to our economy, according to something called the Wall Street Journal. I barely touched on the great stuff that kicks in 2014, like the exchanges, which will allow individuals and small businesses to pool with others to get more affordable health insurance that's the right fit for them. And of course, while presently no child can be denied health insurance for a pre-existing condition, starting in 2014, no American will be denied health insurance or penalized for having a pre-existing condition. The Congressional Budget Office, a nonpartisan agency of Congress, has crunched the numbers and reported that the Affordable Care Act will ensure 31 million additional Americans and bring down our national deficit by billions of dollars in its first 10 years and by approximately $1 trillion in its second 10. I ask the American people not to fall victim to disinformation. There are no death panels. The Affordable Care Act cuts the deficit. Under this law, businesses under 50 employees don't have to provide insurance for their employees and won't suffer penalties if they don't. They won't have to pay fines and won't be dragged into prison. There is so much junk out there that is just plain false. And it's just doing everyone in this country a giant disservice. Madam President, my colleagues and I disagree on many things. Can we all at least agree to talk about this law in a factual manner? The benefits of this law are tremendous, and Americans across the country are already experiencing them. I urge all my colleagues to acknowledge these benefits and to support the continued implementation of the Patient Protection and Affordable Care Act.